Hey, Merry Christmas. Almost Happy New Year. I just wanted to touch base. It's been a few weeks. Haven't had any super exciting cases, but have had a lot of removals. Yesterday, there were 7 cases that we did. And I wanted to point out 2 specific cases on Essure Removal because there were 2 that were phenomenal. One, basically a bad insertion with doctors not listening to their patients. And the second one, a bad removal. The second one, the lady had a salpingostomy where the doctor cut the tube open and pulled out the coil and then didn't do any imaging. So 2 points that I want to make, and I'm going to reiterate this. If you're having Essure Removal, make sure that the doctor does an X-ray before the case, because how are they going to know where the coils are and how many are in your body if they don't do an X-ray beforehand? Second, if you're having just the tubes removed, please make sure that they're doing an X-ray during the surgery to make sure that they got the coils out. Because if they don't do an X-ray during the case, how do they know they got them out? And if you're having a hysterectomy and they don't do an X-ray before the case, how do they know where the coils are? What if there's one up in your abdomen? So please make sure that everybody needs an X-ray before surgery. And then women that are having just the tubes removed need to have an X-ray during the surgery. So I'm going to flip the camera around. You can see that it's kind of gross out today here in Austin. It's pretty gray. But let's talk about this first case. So this first case was just what I would call a bad insertion. So what I'm going to do is I'm going to point out some things here. This is the uterus. These are the tubes. I'll go down here. Tube here. Tube here. What is that mass of shit sticking out the back of the uterus? Excuse my French, but those are both coils right out the back of the middle of the uterus. That yellow stuff is a fat pad around the colon. So not only were these coils not where they were supposed to be, they were sticking out the back of the uterus. There's 2 of them there. You can't tell, but there's 2. And they're sticking into the fat behind the uterus right next to the colon. So these just aren't even in the right spot. I think these were put in badly. I think that you can see tube here, they're sticking out the back. So this wasn't even put in the right place. Now the thing that's funny about this, if there is anything funny, is that this woman never had her follow-up. They never ordered the hysterosalpingogram to see if these tubes were blocked. So this poor lady, by the sheer fact that she was 46 when she got these put on, didn't get pregnant, probably by the grace of God or whatever you believe in, because she was perimenopausal. But tube over there, nothing. Right in the middle, bam, coming out, sticking into that fat. This poor lady was having pain. And you know what's fascinating is this poor lady was having pain, and people were telling her, it's not the coils. It doesn't hurt. It doesn't hurt. Those coils sticking out of the back of your uterus don't hurt. Come on. What is wrong with my brothers and sisters that are practicing medicine that are telling people that they have these metallic foreign bodies in their body and that they couldn't possibly hurt? I call that stoop, and that's short for stupid. So you know your bodies. And this woman that I was talking to this morning that had this done, she was telling me, well, yes, we know that oh, by the way, you're one of my top fans. And so, but we know yours hurt, and you came all the way from Canada to see me. So this lady was having a lot of pain. Now let's look at the second case, because I don't want to bore you all to tears, even though this is pretty fascinating. And how could I be bloody? Boring. I'm not boring. Back to the bleariness outside. All right, this lady, interestingly enough, had a salpingectomy. They removed her coils. They totally removed them. Although, there's a coil right there. There's a tubal stump right here, and there's a coil right there. So what he did was, because I asked her this morning, I said, now, when this guy removed this, she said, well, he cut my tube off, but before he cut my tube off, he cut the tube open, and then he pulled it out. Well, guess what, dude? You didn't pull the whole thing out. Not only did you not pull the whole thing out, you didn't even pull out most of it. But because he didn't do an X-ray during the case, she didn't know she had a big old chunk of it left behind. So this lady had to go back to the operating room and have another surgery because the first surgery wasn't done the right way. So here's one piece of tube left. This lady had a salpingectomy with the Essure removal, although you can see that's a piece of Essure still sticking there. And then this poor lady here, well, this poor darling, she just had a bad Essure put in and sticking into the fat behind her, around her colon. All right, so let's go over this uno mas tiempo, as they say south of the border, or one more time. What you need to do, so let's say you're in Georgia, because I'm still in the Georgia board. They let me hang out there. I've been booted out of some of the other ones because I have an opinion. There are a lot of women in Georgia and Pennsylvania that are going to see other doctors that are having hysterectomies, and that's great. That actually works. It works well. But you need to have an X-ray before you have your hysterectomy, because how do they know how many coils you have? I have seen 5 coils in one person. If I just went in there thinking there were 2, I would have missed the other 3 that weren't in her uterus. So, that being said, if you're having a hysterectomy and there's a doctor out there willing to help you, let them help you. That's awesome. But please get an X-ray. Demand an X-ray. They need to get you a darned X-ray. The complications happen most of the time when you're having a salpingectomy or just having your tubes removed. There are so many women in Pennsylvania and Georgia, and I'm only referencing those 2 states because I'm in their boards, that are having tubal removals done, and they're not having X-rays before, during, or after their cases. While I'm excited that there's people out there helping you, you gotta get an X-ray. And you especially gotta get the X-ray done during the case, because if you don't get the X-ray done during the case, how do they know they've got it all out? If you've had a salpingectomy, please get an X-ray. You can get an X-ray now. If it's been 2 years since you had your coils removed, get an X-ray. I do X-rays in every case because you need to. You need to know if it's all out. The second case that I just showed you, she never had an X-ray done. So she didn't know that there was a big chunk of it. But what she knew was that it hurt. It still didn't feel right. Just get an X-ray. So those are my 2 things. Get an X-ray before. If you're having a salpingectomy or you're just having your tubes removed, get an X-ray during the case, ideally, because then they know. I've had it happen to me twice. Now, I've done about 800 cases. I've had it happen twice where I've removed them, thought I had it all, went back, did the X-ray while the patient was still asleep. Darn it, there still was a piece in there. So what do? You hook everything back up and you go find the piece. And that's exactly what we did. And then we took another X-ray and voila, it was all gone. So what's the downtime, Eva? Downtime for Essure removal, I'm just going to speak for myself. If you have it done, if you just have the tubes removed, a week off of work. If you have it where you have a hysterectomy, it depends on your job, but most women go back in 2 to 3 weeks. The great thing about coming to Austin, well, it's Austin, the traffic sucks. But other than that, you only have to come one time. I do everything preoperatively on the phone. Labs, X-ray orders, we talk about everything. We get your surgery all authorized. You come out the day before the surgery, you get the surgery done, you go home the next day. And that's it. You just need to come out the one time. And it's Austin, so you get some good barbecue, make some recommendations, have a margarita, it's not bad. But yeah, I definitely think that these 2 cases exemplify what we're going to see more and more and more as more women, I said a lot there, but as more women have these surgeries done, we're going to see a lot of them that don't get done right because there's well-meaning physicians, and I'm not saying they're bad. They're well-meaning physicians, but they don't have the experience that I've had to know that you need to get an X-ray, and you can't pull on these things. You cannot pull on these things. I had a patient the other day who called me and said she had hers done hysteroscopically, meaning they put a camera up in her uterus and they pulled from the uterus, which is just horrifying to me to even think about. It's just horrifying. Eva, the number, I think Maddie might have posted it. It's 512-956-0296. Do I take state insurance from other states? Michelle, the one downside to Medicaid is that Medicaid is only good in the state that you're in. I do take Care Credit. It's a website you can go to and you can put in my name, and it's like getting a loan that you pay back. My hospital is relatively inexpensive when it comes to hospitals. They've really tried to cut down on prices for you guys. Surgery, anesthesia, and me together, you're probably looking at around $8,000. But it depends on how miserable you are, I guess. But I've really tried to help in that area. It's just the hospital is the biggest piece, but they do try to work with y'all. If you have any questions, I'll stay on for a few more minutes. The lighting is super good. I look really good right now, so I'm gonna stay on for a minute. And it's one of those views where I'm looking up too, and I didn't think that was good. I thought you're supposed to look down, but the gray's kind of coming in real good. But yeah, December is usually a really busy month because a lot of women have their deductibles met, so we've been slammed this month. But and yeah, you're right, Miss Hilliard. The hospital where I operate is amazing. They constantly win every quarter. HCA is a hospital system in America. They have over 100 hospitals in their chain. That hospital where I operate every quarter for the last year and a half has won customer service satisfaction surveys because the nurses there aren't overworked. It's a beautiful, brand new hospital. The food is actually pretty good. They have waffles that are shaped like the state of Texas. I mean, hello, where can you get that? But it's just the nursing staff is superior. Oh, funny and cute. Well, thank you. Those are two qualities I'm working on. But no, I think it's time. It's time to get these coils out. Let's make 2020 your year. I just think it's a 45-minute surgery. I've done 800 of these. They're all different, but they're all super important to me. And I never meant to do this for a living. It just sort of happened about 4 or 5 years ago. It's not Medicaid, it's medical assistance. I don't know. Why don't you call the office on Monday, 512-956-0296. And Maddie's on here right now. Maddie Montalvo is my surgery scheduler. She can get your information and kind of look that information up for you. We can always check. Worst case scenario, it's no. Best case scenario, it's yes. And then you can come visit. So let's, what other hospital services? Shrimp scampi. Yeah, I'm telling you. Shrimp scampi. I don't even like shrimp, and I've eaten it. It's pretty good. They have a really nice Thai chicken soup. But enough about the food. I'm hungry. Anytime you have a question, please feel free to ask me. Thank you, Laura. Please feel free to ask me. My staff is amazing. Kim has been with me for, much to her dismay, for probably 4, almost 5 years now. Kim's going to First Assist School for surgery, so Kim will be in all of the surgeries. So you get to know Kim really well. Maddie's been with me for, 2 years, a little over 2 years. She's amazing, really working on giving you the best possible experience, and I think we do a pretty good job. It's not just me, and it's because of y'all that I've gotten this experience. It's because of the women investing their trust in me that have come before you and told their stories and really allowed that door to be open. It's because of all of those women that now I'm getting phone calls from Australia to come out there and be a part of the process of educating the doctors out there. It's helping other women. And I think if we can keep focusing on not the negativity, not the wanting to do this and that and this, but just wanting to get better, healthy, better, move about your, I had a couple of kids send me a picture the other day. Thank you for giving us our mom back. That's what matters, really. I mean, that's what matters, and that's what should happen in 2020. So the downtime, Maddie, I answered that about 5 minutes ago. For a salpingectomy or just having the tubes removed, it's about a week. For a hysterectomy, it's about 2 to 3 weeks, and that's not 100% recovery, but 2 to 3 weeks until you can go back to work if you have a relatively easy job like you and Kim do working for me. At least that's what I've heard. I don't know. So any more questions? It's December 20th. I still have to do some shopping. I have a lot of the Louis Vuitton bags I need to go buy. I wish. I can't say what I bought because my daughter might be watching this. But I have 4 kids, so Christmas is always rough because they break me. They literally break me. But it's one of those things where this is a good time of year to kind of think about what you want to do going forward next year. I think that it's a good time to get healthy. 2020 for me is, I will tell you right now, my resolution for 2020 as a human is learning how to love myself. Been a struggle for me most of my life to look in the mirror and go, you're all right. So that's going to be my challenge this year. Get healthier physically, emotionally, and to be more, just accepting of who I am and the gifts that I have to bring to the world. Maddie, I will add you to my bag list, but it might be a grocery bag. I don't know. Just depends on how much money I got. Elda Castro is here. Lovely Elda. Wonderful woman. But all of you are wonderful. And Elsa wants a bag. So, yeah, we're just basically going to buy a bunch of Louis Vuitton bags. And I'll just be handing them out like Santa. And I'll probably be a popular Santa at that point. But that's why you all have significant others. Tell them you want a bag for Christmas. I mean, my goodness. Any questions about Essure Removal? I'm here. I'm always here. I'm always online. Instagram, Shawn Tassone MD, at Shawn Tassone MD. I'm not on a lot of the other pages because I can't say what I want. So if you can try to share this to others on other Essure pages, I don't know if the admins will let it be posted, but if they do, that's awesome, because I do think that this message isn't just to get people to come see me. It's to get people the right information so they can make the right choices and get to the doctors. There are a few of them out there. I can think of Darren Swainston is in Las Vegas. He's great. He's doing some good work right now. He does Xrays. Ed Derone in Atlanta does the procedure the way that I do it, and he's a great surgeon. I don't know if Ed is doing Xrays, but I'm sure he would order them if you started asking. Those 2 folks right now are the only 2 that I know of personally. I'm sure there's other doctors out there helping, but Ed and I have done hundreds. Darren's just getting up and running, but he's an awesome surgeon. He does tons of surgery. He's a great guy too, bedside manner. Almost as handsome as I am. What are you gonna do? And yeah, so basically what I would do is just get in touch with me or somebody by you. But if you ever have questions, like if you see somebody and they won't do an X-ray, I'd see somebody else. I think that's a no. That alone is a no-go. That is like almost as bad as going out on a date with someone and having them be a horrible kisser. I'm sorry. That's a deal breaker. Bam, done. No X-ray. Find somebody else. You don't have to kiss your doctor. But you know what I'm saying. Bad date, bad kiss, done. Go visit your doctor, won't do an X-ray before Essure surgery, done. Find another physician. It's really that simple. That tells you right there, that is a litmus test for you to know that they don't have experience with Essure, or they don't have the respect for the coil and the fact that it can break, and they don't have the belief that it's causing you problems, because if they did, they wouldn't want to leave even a speck of it in there. So if they're not doing X-rays and they don't know that they're leaving a speck, or possibly, then find somebody that does, because there's got to be somebody out there. And like I said, it's not like I live in a horrible place. Austin's a wonderful place to visit. Come spend a few days, get some great barbecue, learn how to say y'all. We can go to the Broken Spoke and do some line dancing, I mean, hell, actually yesterday in the OR, I did honor the OR staff, and as their Christmas present, I let them listen to George Strait. which would not have been my first choice, but it was all right, I suppose. So if you don't have any questions, I'm going to get going because I got to eat. My tummy's rumbling, and the Amazon guy is here, so I must have ordered something for one of my children. Have a great Christmas. If I don't talk to you sooner, love you guys. You're the best. Take care.